Good evening, dear Foxians. It is privilege to welcome you all to Gyaan Pravah, the flow of knowledge, a visionary podcast series born under the dynamic and transformative leadership of our beloved President, Dr. Sunita Tandulwadkar. I am Dr. Sejal Naik, Chairperson of Endoscopy Committee FOGSI, and I am honored to host this platform each month, bringing to you the matters, minds that inspire and legends who have shaped the very core of gynecology, endoscopy, and women's healthcare. In just 6 months of her presidency, Dr. Sunita Tandulwadkar has achieved that most could only dream of accomplishing in lifetime. Her vision, commitment, and boundless energy have propelled FOGSI to new heights, making her presidency nothing short of historic. Her iconic initiatives like Sampurna, Know Your Numbers, Gyaan Pravah, Do Tike Zindagi Ke, Anubandh, Eagle have defined what it means to FOGSIan today. There are not just projects, they are movements. They have touched every stage of women's life, from adolescent to motherhood, from preventive care of like in endoscopy, from mental and spiritual well-being and environmental awareness as well. With Eagle 100, Gyaan Pravah podcast reaching 192 episodes today, Sampurna CME reaching every corner of country, Do Tike Zindagi Ke empowering thousands of HPV awareness and vaccinations, her leadership has truly soared like an eagle, covering skies never reached before. FOGSI is flying higher than ever with her at the helm. We are not just reaching milestones, but we are creating them. Today, we spotlight a groundbreaking innovative in gynecological endoscopy, natural openings, limitless possibilities through V-nodes, a scarless minimal access surgical technique that redefined the boundaries of precision and recovery. We are privileged to have with us Dr. Suyash Naval, one of the India's foremost expert in V-nodes and the founder director of the V-nodes Academy of India. A pioneer, innovator, and global educator, his contributions have opened new doors quite literally in gynecological surgery. And finally, this very platform of Gyaan Pravah, now with 192 episodes and counting, is itself a symbol of Dr. Tandulwadkar's innovative leadership, a living, breathing library of wisdom where medicine meets art, politics meets purpose, and science meets soul. With every episode she encourages each one of us to grow, not just as a clinician, but as a complete human being. With immense pride, respect, and admiration, I now invite our visionary leader, our president, our mentor, and our guiding force, Dr. Sunita Tandulwadkar, to grace us with her words and inaugurate this truly enlightening session. Welcome, madam.
I don't know whether I deserve all words, but you know what? Let me be grounded only. By listening to all this, I will start flying also myself. Let my roots be rooted absolutely on the ground, and we are doing a very humble way all the efforts. You all committee chairpersons, the vice presidents, our all joint secretary and joint secretaries, all are making this so enjoyable. More than that, the milestones are happening because we are enjoying our journey. We are enjoying our practice. We don't leave anything. We are balancing the family life, the organization life, the work life, and everything. And that is why it is making the meaning of it. There's no point leaving everything and doing only one job. We never do. We multitask. And I can do multitasking only because of you all. Naval, thank you so much for coming on a FOGSI platform. It's our absolute pleasure. I think Naval ko, I had given him a break when I was an IAG president.
Yeah, exactly. First one to invite me on a national platform.
Yes, I do remember, because during IAG presidency also I wanted to bring all these You were one of them. Then I think Dhaval was also there. And I definitely remember Deka from East India. Unka state chapter installation, I told them, ki give him a break. He's a young guy doing a good work. We should be giving them. And same was with Naval, because I always want the young talent to shine instead of pulling them down. Though Naval, frankly speaking, मुझे कभी जमेगा नहीं. We notes ulta side से. Even if for the sonography, when I take the curvature up, if the curvature is reverse, I change the probe to the return to this, because I can't do ulta ऊपर से नीचे. So I definitely feel मैं बैठ के vaginal hysterectomy कर दूं. मैं क्यों नीचे से इतना कर रही हूँ? Why?
I think, ma'am, number of things that you do, like you multitask, ऐसा कुछ नहीं है जो आप कर नहीं सकते.
Exactly.
But no, I definitely feel that VNOT needs more skill and more experience than our routine laparoscopic surgery. So thank you, Naval. What I appreciate is, see, single port surgery came and wave off. You know, everyone understood its limitation. There's no point in 2 5 millimeter more port. You can do more and wider range of surgeries. But you did not allow VNOT to die in India. And I know internationally also you are pushing yourself the boundaries. I still remember even in my year in AHL, you were involved and you presented your work. So that is what is needed by the youngsters, is a perseverance. And perseverance, you can do that only because of your faith on the system. You are convinced yourself, and that's why you are trying to convince everyone. So I'm sure, Sejal, you will have a great podcast dialogue, and let Naval this dialogue to reach on many more platforms. She will give you the link and post wherever you can and promote your VNOT to India. Who knows? There may be one complete branch 10 years down the line will come out only with the VNOT surgery. The entire conference may go. I wish you both all the best. The both excellent upcoming, I should not say upcoming. You people are established. You are established endoscopic surgeons. Upcoming are those who have started just less than 6 months. You are established, proven your talent again and again, and enjoy your podcast. Thank you. Thank you, Naval. Thank you for being here.
Thank you for your
Thank you.
encouragement.
Bye, Sejal.
And before you,
Yeah. So thank you so much, Madam, for giving us this platform. And it's my privilege to introduce Dr. Suyash Naval. What happens when surgical precision meets fearless innovation? You get Dr. Suyash Naval, a name that now synonyms with VNOTs in India. A gynecologic endoscopies and the vaginal surgeon par excellence, Dr. Naval is not just a master of minimally invasive surgery, but a true pioneer. He is the founder and director of VNOTs Academy of India, a leading center that has empowered countless gynecologists through structured, globally recognized training in scarless surgeries. From performing high-end surgeries across Naval Multispeciality Hospital Jalgaon, Fortis Hospital Mumbai, and Sushruth Hospital Wardha, to introducing VNOTs and microwave ablation for fibroids and adenomyosis to India, Dr. Naval has consistently pushed the envelope of what's possible in gynecology. His accolades speak volume. Recipient of AAGL Kurtasem Award, IAGE AAGL Young Excellence Award, 6 national and international Best Paper Awards, and even a Lokmat Maharashtrian of the Year nomination. With over 20 international publications, 5 book chapters and innovations like NoteSync device, pure VNOTs morcellation, gasless VNOTs, and the Lab Easy simulator, he is not just practicing medicine, he is reshaping its future. But beyond the OR, he is also technology enthusiastic, a neuropaleology fellow, and someone who finds joy in history, neuroscience, psychology, and good game of table tennis. Today, we are thrilled to have him on Gyaan Pravah to dive deep into a field where less is truly more, an art and science of Venus. So we welcome you, sir, here. And today we are definitely sure that our viewers will have a completely new insight about what is natural orifice surgery through the vaginal route.
Thank you so much, Sejal ma'am. And I'm always inspired by you because I see you in almost every event of FOGSI, of IAG, and especially the way you have conducted the Eagle project. I'm sure that all the postgraduates and all the juniors will be very thankful to you down the line for the exposure which they have got very early in their career. And I really love the caption of today's podcast, Less is More. And I think we should discuss about that. Yeah.
Yes. So let us begin with our question is like I would like to know V nodes is often described as scarless revolution in minimal invasive gynecology. So can you walk us through the basic principles and what makes it such a breakthrough in surgical access?
So see, V-notes is, as I always say, V-notes is not a new route of surgery, right? It is a new way of doing vaginal surgery. And we all know that nobody can argue with the statement that vaginal route is one of the best routes of gynecologic surgery as far as hysterectomy goes. There is loads of evidence about this. It has stood the test of time. So in terms of patient outcome, vaginal route is one of the best. Okay? And V-nodes is an addition to it. The only problems with vaginal surgery is that the classical one. There is, compared to laparoscopy or robotic surgery, there is a restriction of space. It is generally the surgeon only who is having a good view of surgery. The assistants and the rest of the people in OR, they are generally clueless that what is happening. And, so it is very difficult, therefore, to teach also, difficult to learn also. And today, whoever is passing out their OBGYN residency, they are comparing it with laparoscopy and robotic surgery and all these things for which there are plenty of courses which are available. But the vaginal surgery still is so important and vaginal route is so important because of the patient outcome and evidence. But unfortunately, across the globe, the number of vaginal surgeries being performed and the route being utilized, even for a basic surgery. Forget about the difficult and large uteruses and difficult surgeries. We are talking about simple non-descent surgeries or sometimes even the prolapse surgeries. The number of vaginal surgeries performed are dwindling. And this, unfortunately, is true even for India. India, which is a country, we are known for our vaginal surgeries. Probably even today, the number of experts in vaginal surgery that are in India probably are most in the world. But I'm not sure we'll be able to say that in future. And I think V-nodes is this one kind of a lifeline that will revitalize, that is already revitalizing vaginal route, and the kind of progress which we are seeing in many continents, in all the continents, not just in India, in Europe, but it is everywhere. It started from the East, and I think V-nodes has this potential to explore the natural orifice in such a way that we are not just talking about hysterectomies, we can do all kinds of adnexal surgeries and then go to the next, pushing the next envelope of doing really advanced surgeries.
So it is said that for the open versus laparoscopy, that why you want to break the door when you can open it with the keys. So for vaginal, it's like it's already the open door. You just have to negotiate yourself through it. Wonderful, sir. So that idea of actually make you interested to go further into this V-node surgery. So what were your initial thoughts when you first encounter or perform V-nodes procedure? Was it challenging to shift from, conventional laparoscopic procedure to the transvaginal route, and like how and why you started performing your surgeries through V-nodes?
So this is a very interesting story. When I was doing my fellowship with Dr. Amay Padmawar and Dr. Shailesh Kuntambire sir, in the journals, I used to read a lot of journals. And in the journals, I read a publication about PH. And that got my attention. That, we are doing laparoscopy. And I have been trained in vaginal surgery by Dr. Paili sir in Kerala, and especially my father, Dr. Suyash Naval, who is very well known in our region, especially for vaginal surgeries. So I had these decent skills of vaginal surgery. I would not say that I'm one of the experts in vaginal surgeries, but yeah, so I was decent in vaginal surgeries. And of course, then I moved on to laparoscopic surgery. And I was like, this V node seems to be a good combination. So that idea caught my attention. But then whenever I searched, I thought that this is kind of a research level thing right now, and it is not a mainstream thing. Then couple of years down the line, I read even more publications and I got interested. And then I tried to search, where can I learn this technique? There was nobody in India. I could not find globally any person who is, all I could see is some publications. I could not find out where there are training courses. And then, as luck would have it, I was invited to one of the conferences in Delhi, which was a hysteroscopy conference, a pure hysteroscopy conference. And just before my lecture, there was lecture by Professor Suwan Su, who is from Taiwan, from Shanghai Memorial Hospital. And in his CV, I read first V node hysterectomy in the world. And then we were staying in the same hotel, and I caught hold of him, and we had a long discussion. I asked him every possible question about V nodes, and he was kind enough to share with me his publications, some of his videos, and he guided me that how and why we can start V nodes in India. So he really inspired me. He was my first inspiration to do that, because the kind of surgeries he told me that he is doing, I was like, this is sounds like a revolution, a paradigm shift. So that is one thing. And secondly, in my hospital, because my father is very well known for vaginal surgery, he had a legacy of patients, second, third generation patients coming to us. And when I counseled them about laparoscopy, they used to tell me that, my relative, you did a scarless surgery. There is no ports on the abdomen. Why don't you do the same thing for me? So then I was like, this is a perfect opportunity to start doing V nodes. And that is how we started. Although we did not have training program in earlier, but whatever material that I had and whatever guidance I was given by Dr. Su, I used that to create our own homemade endotrainers. We used 500 ml saline bottles, inserted ports into that, made a tiny uterus out of a mop, and we used to do hysterectomy and we used to practice. And I showed all the videos that I had to my assistants who are going to, because it is very important. We are doing surgery as a team. If only I know what I'm going to do, it will be a big surprise for them. So I showed them videos. They saw the videos for 50 times. I saw it for so many times. We practiced on these homemade endotrainers for V nodes, because there is no such thing, no platform. And then I explained my patient that, this is a vaginal surgery. We are good in vaginal surgery. We are good in laparoscopic surgery. And we started with V nodes. And the first case, we thought that even if we convert, it would be a vaginal surgery, or we complete by laparoscopy. And the rule being, if we are understanding the anatomy, if we are understanding the structures, we will continue with surgery. If we are struggling, we should basically convert. That is something which I follow even. And the first case itself, fortunately, we completed within 2 hours V node hysterectomy for adenomyosis. And from that point onwards, there was no looking back. Okay. And but there were teething difficulties, because V nodes comes with its own set of problems, because obviously you are operating through natural orifice, and the techniques are standardized now. But then when we are talking about 2018 March, 2019 I started. Okay. So by that time, and especially we being in India, we were not aware of so many things about V nodes, nitty-gritties of it, because it was being done at different localities in research centers and everywhere. So what we started doing is that we tried to point out what are the problems, and instead of giving up on technique, we tried to find out solutions. Like, for example, the glove port, we did not have any access to, or any company has not made us dedicated port by that time. So we had to use glove coat. The good thing about glove coat is that it does not add any cost to the, so we are doing surgery almost at same cost as laparoscopy. But glove is a flexible thing. You have to manage that. Then how to apply glove, which glove to use, what size to use, and whether we should keep the thumb anteriorly, whether we should keep the thumb of the glove posteriorly, all these things. So correct. So figuring this out, every 10 case, we had to change something to understand what we are doing wrong. And we used to try again on endo trainers and go back to the surgery. So all this thing, we came up with a solution for everything. Then there was the problem of smoke, because as you coagulate, the smoke concentrates in narrow pelvis and vagina, unlike laparoscopy where you have cross ventilation. Then we solved the problem of smoke by making a device which manipulates the uterus and also evacuates the smoke. So this gave us the platform, not just to do new surgery, but also to innovate so that it can be made better. So
it's like
that's where the teething difficulties. So now what we do in our training programs is we tell them what not to do.
You have
as much
ready-made
as we tell
recipe
them
now.
what to do. Yeah, right.
So they get the ready-made recipe from you now.
Yeah, it is very important because everyone making same mistake, going through same journey is pointless.
Yeah. So your journey says that if you are from your core, you are desperate to achieve something, automatically you start getting ways, and the push up, like more of a pushing force to go and get your the destiny nearer and nearer to you. It has to be, as Madam said, perseverance, continuous learning, continuous improvement, your dedication, time, and being not frustrated while getting setback. And that is all the qualities you require to be into the system, making a new change, or as you say, paradigms change in the society, or maybe innovating something very unique and new, making it easy for others to learn as well. So many gynecologists are still, hesitant about adopting V notes. I can say, including myself. What are the practical learning curve, and how can we build more confidence in this technique among upcoming endoscopic surgeons?
I think, Sejal ma'am, what happens is that when we look at the videos or lectures in the conference being presented on V notes, first of all, most of the people sitting in the audience, they have a comfort level of abdominal surgery or laparoscopic surgery, the anatomical orientation. So in the first glance, they find it a little weird that what is this anatomy? Then they feel that the field is smaller compared to laparoscopy, which is true. So this gives an impression that this surgery is difficult. But actually it is not, because see, as I told you in my journey, in the first case, I was expecting that we would stop the surgery within 5 minutes. But to my surprise, we were able to continue, not only continue, but finish in a decent time, I would say. So it is surprisingly easier once you approach it. It is the problem of mindset that we think that it is difficult and we restrict ourselves. For any new thing, I think we need to take that leap, at least give ourselves the opportunity that we should educate ourselves in something new, which has, see, now VNOTES is not new. It has been around since 10 years now. A first publication you can see in gynecology, 2010. So more than 15 years now. And if it is only spreading its wings and it is not stopping, that means
so from hysterectomy now,
established.
Yeah,
right.
moving
so it is
towards the more
technique.
operative.
Right. And I'm very thankful to International Note Society, because when I went to AAGL and also did a course after doing 60 V-Note surgeries, I went for a training course again with Dr. Bekilant, and because they had formed a Note Society and had developed a standardized training program. So from Europe and from US, this structured program is coming. And then with them, I collaborated to start training programs in India with V-Notes Academy of India. Okay. And so with this, what has happened, the training program is also now structured. We have 1, 2, 3, 4 levels and a proper credentializing system. So this makes the transfer of skills easier and in a stepwise approach. We all know every training program is a photocopy of the earlier training. So we know what we are doing. We know we take the follow-ups, and everybody who is being trained has to submit the data of their first 10 cases.
It's great opportunity for youngster. You never get the opportunity to learn at your homestay. But in India now they have these facilities, so they don't need to go abroad to learn themselves. So my last question would be, in this era of advanced laparoscopic, 3D and robotics, in terms of patient's outcome, the recovery time, pain, cosmetic, hospital stay, does we know is comparable?
Yeah, not only comparable, but there is just a recent publication, I'll tell you, in July 2025, which is probably the first publication which is comparing V-nodes, robotic V-nodes, laparoscopic hysterectomy, and robotic hysterectomy all together, put together. Okay. And this is again coming from Taiwan, because the V-nodes journey started from Taiwan, from Shanghai Memorial Hospital. Dr. Su, Dr. Lee, this was the group who shifted from single incision laparoscopic surgery to V-nodes. So now they are doing everything, and they are publishing studies which compare everything. So the results of this study says that one of the best outcomes for patients is with V-nodes in terms of operative time, in terms of blood loss, in terms of patient recovery in general. And also complications are comparable. And in fact, to tell you, bladder injury may be slightly more in V-nodes because you are approaching vaginally. But if you learn the proper techniques of lateral window dissection, which Dr. Shirish Sheikh had described, and he had described it vaginally, so we can very well apply it by V-nodes, then your bladder injury reduces significantly. With the vaginal route, the biggest advantage is that ureteric complications are very, very rare. I always tell in my courses that you require special skill if you want to injure ureter transvaginal. Right. So these are the advantages. And now for whatever the advanced cases, for people who find V-nodes still difficult, in spite of having laparoscopy skills and vaginal skills, although it is very rare, because if you have already trained in vaginal surgery, if you are already trained in laparoscopy, all you have to learn in V-nodes is how to apply V-nodes code and to get oriented to anything. You already have hand-eye coordination. You already understand transvaginal. So there is very few things to learn. That's why our training course is only of 2 days. And the next stage of V-nodes is for the advanced surgeries, really advanced surgeries. Robotic V-nodes is going to revolutionize significantly. And not just in gynecology, robotic V-nodes is being utilized in female patients by urologists to do, renal transplant, and from a donor patient, they retrieve kidneys by V-nodes. So this has already started. And with newer robots coming in, like single port robotic surgery, you can apply the same single port robot transabdominally, and same goes transplant. And I am fortunate enough that we did the first appraisal of a new kind of robotic system, which is handheld robotic systems, which I think is very unique. It combines your laparoscopy and robotic surgery. That is, you hold the arm, which is lightweight, in one arm, and the other arm, in other hand, you can do it with your normal laparoscopic instrument. So if you already have laparoscopy skills, but you want some advantages of robotic surgery, that is articulating instrument, then you can combine these two things, and this is very useful for V-nodes. I think it is very useful also for laparoscopy.
So it gives more 360 degree of movements, and
exactly.
In a narrow space, it is really very useful. Yes.
Very useful, especially for suturing in narrow spaces, even for all your prolapse cases and everything. So even if you compare with robotic surgery or laparoscopy, V-nodes is not only comparable, but is having, as far as all the systematic reviews and meta-analysis, the data says that it is faring better.
Thank you so much, sir. It was really inspirational story, and we have these, have to think out of the box to achieve something new or innovative that can be benefit ultimately to the women's health and their suffering, their morbidity and everything. It was wonderful conversation with you today. Sir, only one last question. We note in one word for you.
A paradigm shift in minimally invasive surgery and a technique which has a very, very bright future.
Thank you. Thank you so much. It is really motivational and inspirational. Especially many youngsters will be the follower of VNotes Academy, and they would wish to make this, and the future will be taking them this VNotes to the very higher in coming years. They will take this procedure at a different level as a
Thank
legacy started by Dr. Suyash Naval in India. Thank you.
thank
Thank
you.
you so much. And
Thank you for this honor and opportunity by FOGSI, Gyaan Pravah, the entire team, and all the committee members of FOGSI. Thank you so much for giving me this platform to speak. Thank you.
thank you so much for being our guest today. And it is really, we all are energized to start thinking something new out of the box from now onwards. And people would love to watch this podcast again and again. Thank you, Foxy and Dr. Sunita Madam, for giving this opportunity. And thank you, Evangel, the technical team, for all your support. Thank you.
Thank you.